Hi, it's February 21st in Kyoto, Japan. This is a follow-up to yesterday's video on the data from the Diamond Princess cruise. So let's get right into the numbers. Okay, first a quick review from yesterday. So on the Diamond cruise ship there were 184 symptomatic cases that tested positive, 205 asymptomatic cases, and that left 103 people who had the onset of their symptoms was not certain. So these 184 people, they could confirm when the onset of their symptoms was. 33 of those people had symptoms before the quarantine started, and of the rest of those people, 155 symptoms started after the quarantine. However, that doesn't necessarily mean that there was a problem with the quarantine. And the reason for that is the incubation period of the virus. So here we can see that if the incubation period is about 2 to 11 days, there should be a peak of after about 1 week. So on either side, about a 2-week period with a peak in the middle. So if you extrapolate, so this was from the data in the report that was released, and so if you extrapolate, if this is a peak and you extrapolate backwards, you can see that this outbreak probably would have started before the ship arrived in Yokohama. Of course, and that's not the whole story, of course. So there are these 103 people, so we're not really sure what to think about them, but the Japanese government is saying that we have to make our assumptions about the outbreak based on this curve, which is based on data from people whose onset of symptoms we can confirm. So I made a new graph. Here's the new graph, and let me explain this graph before I talk about it. So what we have in this graph is across the bottom are the days from February 5th to February 19th. That covers the quarantine period. And along the side we have number of cases which tested positive. Those are not symptomatic cases, those are number of cases that tested positive. You can see this blue line here is the same as this peak. This is the peak which represents the passenger symptoms, and this is the peak which represents the crew symptoms. So on this chart you can see here's the line of the passenger symptoms, the orange line is the crew symptoms. And the rest of the chart, so this pink line, these represent the cases that tested positive, okay? And over here the yellow area is on the 14th of February they started a systematic testing. So again, before this they were only testing people who came with a fever or other symptoms, and then after this point they started testing everyone symptomatically. So what we saw in the news was at some point they started reporting like 70 new cases, 80 new cases, and it looked like there were more and more people getting sick on the ship, when in fact what was happening is that they just started testing everyone. So they would test a group of people, and then from that group of people they would get a number of positive hits, of positive tests for coronavirus. So this is theoretically compatible with an outbreak that started before the ship went into quarantine. In that case, because these people are being tested systematically and not from new symptoms. So these numbers, again, they don't represent new cases of infection or new cases of symptoms. They involve or they represent new positive tests. So it's theoretically possible that these people acquired the infection back here at a much earlier time, but because they weren't symptomatic, they weren't caught until the Japanese government started testing everyone systematically. So that said, I do have to say that, so there's an interesting thing here. The 11th of February was a national holiday in Japan. So presumably there was no laboratory testing going on at this time. And you'll notice that there's this interesting peak here. These are new positive cases of test results. But if there were no lab going on here, you notice there's no result for this day. If they rushed a bunch of tests on the day before the holiday, and let's say if they normally would have tested, say, 40 on this day and 25 on this day, that would and they rushed it to beat the holiday. That would mean that if you had 25 here and 40 here, this would start to look like another curve, which could represent another outbreak on the ship. So in that case, if this is similar to this curve here, so you have a peak and going back a peak on the 17th, so going back about a week before that would mean that there would be another outbreak that started probably around the 9th or 10th. So again, that's completely speculative. So what's going on here? They're testing people in batches, and so they're getting positive test results. But again, they're not testing people specifically related to the people's complaints. So it's possible that this does not represent a curve. That this might be an accident. Okay, so again, I guess this really comes down to whether or not you trust the Japanese government. So there's this issue, right, of these 103 people. So the government is saying that these 184 people, they know when those people's symptoms started, so they can use those people to model the outbreak of the disease. But then there's these 103 people, and they're saying that they don't. Those people had symptoms, but they don't really know for sure when those people's symptoms started. So that sounds a little bit fishy. But again, so it's a question of whether you trust the government or not. By nature, I'm kind of a skeptical person, and I generally, in this kind of situation, I think I would usually jump to judgment and say that the Japanese government is trying to manipulate the figures here in order to make it look like their quarantine worked better than it did. However, I think in this situation you have to consider that if it were true, if the government were actually ending the quarantine on the ship and sending people back to their home countries, even though they know that the people could be carrying the disease because they know that there's this other outbreak on the ship that they're trying to cover up. In that case, those people are, it's like a sociopathic level of criminality, basically. I mean, we know that if the disease spreads enough, there will be more deaths from the disease. So that would be a really terrible thing. It's difficult for me to believe that healthcare professionals would make a decision to cover up an outbreak like this when the result of the cover-up would be a worldwide pandemic, possibly. You also have to consider that it isn't just foreign nationals that are being repatriated from the cruise ship in this case. There are also a lot of Japanese people on the cruise ship, and those people are going back to their cities in Japan. And so if the people who are running the quarantine on the ship are aware that there was a second outbreak amongst the passengers on the ship, then they are fully aware that they are sending people back to their home countries or home cities who are potentially going to spread the virus within Japan. So that adds another layer of you can't call it incompetence. This would, if they know that there's a secondary outbreak and they're covering it up, that is really criminal activity, and they would be potentially wiping out numbers of Japanese people in addition to the global pandemic. It's really hard for me to believe that the authorities think that there was another outbreak and that they're covering it up. In this case, I really believe that the people who are in charge of the quarantine are believe that the people that they're sending home are free of the virus. So, are they sending people home who have the virus? So one of the people who commented on my previous video mentioned the case of these Australians who tested negative, went back to Australia, and are now testing positive. So this is a problem with medical testing. You always have a choice when you design a test. You can design it so that it's really tells you for sure when there's a positive result that the person definitely has it, but those tests tend to miss some people, and then other kinds of tests will catch everyone, but they tend to return some false positives. So in this case, maybe the coronavirus test is missing people. There is some evidence of that, I think, from China. There was some question in the past of cases that where people were tested multiple times for the virus in China and they kept coming back negative, and then on like the fourth or fifth test they came back positive. So some people could be getting sent back. It is interesting. So if these people are getting symptoms on the 21st, if they had even the longest incubation period. So I'm saying that based on previous research that was done, that the incubation period is in the realm of about 12 days to 2 weeks. I'm pushing that to the outside. Actually, the research was 2 to 11 days. But if we just consider it 2 weeks for convenience, if those people are getting symptoms on the 21st, 2 weeks before that would be the 7th. So that's still inside the quarantine period. So that doesn't look very good. It is difficult to know, though. So they were on the ship in their rooms. So the thing with the incubation period is, so maybe they got the infection 2 weeks ago or sometime in that time, and they're just getting symptoms. It's also possible they just contracted the virus and they're just getting symptoms now. So maybe, for example, when they were leaving the ship, there were some other people that were around them who had the virus unbeknownst to those people and passed it on to them. So this is not a 100% confirmation that the quarantine was failing, but it does make things look pretty bad. I shouldn't say pretty bad, but it does throw into question whether the report from the Japanese government is completely accurate. I'm not going to say that they're lying. As I said, I don't think that they are, but maybe they're making a mistake. Okay, another issue in all this, everybody probably now has seen or heard of Professor Iwata, the infection control doctor from Kobe. He posted that video where he said that the quarantine conditions on the ship were not adequate, and that there were a lot of people that were breaking infection control standards. He made that video before the government released its report. He has taken the video down now, and he's done subsequent extensive interview with foreign journalists in which he says that he's much more comfortable with the situation after having read the report. So I encourage everybody to listen to the entire hour-long interview. You can see it on the website of the Foreign Correspondents Club of Japan, and I'll put a link to that both in the show notes and at the end of the video. So if you listen to Professor Iwata's interview, you'll notice that he seems to be very comfortable with the quarantine, that the quarantine for the passengers was basically effective, but he does say that there was a secondary infection amongst the crew. So that was this second orange peak here. So in yesterday's video, I had suggested that the crew infection started before the quarantine period started, based on extrapolating this backwards. That's pretty, as we would say in Japan, giri giri. So that's right on the edge. So I shouldn't second guess the professor who's a professional in infection control and also had firsthand experience of the situation. So he's saying that this infection curve that's represented by this symptom these symptoms, reported symptoms, that this actually started before the quarantine period, but that this infection amongst the crew perhaps started during the quarantine period. I don't know what he would say about this situation. So again, I caution. This looks like a curve, especially if we take into consideration that maybe these were rushed, and that we would have 25 here, 40 here. But again, so these are tests of non-symptomatic people, and so we can't really, if we're trying to model the outbreak, we can only use symptomatic people. And so we don't know what to say about these new cases over here. Last point I'd like to address in this video is the question of whether the cruise ship should be used as evidence that the disease is airborne. Some people are saying that it is. Dr. Campbell, I think, has started reporting that the cruise ship is evidence that the disease is airborne. What I'd like to point out here is that you can't say both that the infection control practices on the ship were inadequate and improper, and that the outbreak is evidence that the virus is airborne. It is possible that both are true, but if the infection control practices on the ship were not correct, then we definitely cannot say that the spread was due to the airborne quality of the disease. On the other hand, if the disease is airborne, it may be that the infection control practices on the ship had nothing to do with the spread of the disease. So we really have to choose one of these two things. So to summarize, I think the point that I'm trying to make here is that the large number of cases that keep being reported are based on the systematic testing, which came in the second half. And so those do not represent new case. They don't represent new infections necessarily. They could represent new infections, some of them, we don't know. But they just represent positive test results. They don't represent people who are getting sick. They don't represent people with new symptoms. They don't represent people who have just gotten the infection. So again, because of the way that they changed the testing procedure on the 14th of February, the large jump in the number of cases cannot by itself be taken as proof of an ongoing outbreak of infection on the ship and a failure of the quarantine. On the other hand, as I showed, so some people have been critical in the comments on the previous video, and as I showed, so it does look like there's a rise, a rise in the number of positive tests, which again, it may just, this could be observation bias and confirmation bias working together. Maybe there is actually no graph and peak going on there, but it looks like it's possible that in addition to the initial passenger outbreak, which was reported, and the crew outbreak, that maybe there was this other passenger outbreak, which would have started again probably around the 9th or 10th of February and within the quarantine period. So hopefully that's not the case. Thanks for listening. I'm going to keep paying attention to the news that's coming out of the National Institute for Infectious Diseases. Keep looking for Professor Iwata on the internet, and continue making videos if there's any new information. So I guess you have to, I'm presenting some stuff, you have to decide for yourself what you think. I'm basically trusting the Japanese government. If the Japanese government is not being honest in this situation and is trying to cover up the failure of the quarantine on the ship by manipulating the report that came out, then that would be really terrible. So I really don't think that's the case. Thanks very much, and if you want, you can also follow me on Twitter at Kyoto Kenshu. If I update more of this information in the future, I'll probably tweet it out there. Thanks very much. Bye.